The peak of the pandemic is here, but it's likely not the only one we'll face. We get an update from Kansas' top health officer, plus demands the state reopen now.
I do not fear the government!
As hundreds of small businesses fear this pandemic will run them out of business permanently. And a pandemic-induced budget crisis. What could it mean for you as the state is forced to tighten its belt again? That's what we're talking about right now on Kansas Week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.
I'm Pilar Pedraza, and this is Kansas Week. From budget shortfalls to businesses facing permanent closure, it's been a tough week here in Kansas as the pandemic reaches its peak. Let's start with a look at the latest numbers. Friday, the state announced another 295 cases for a total of 2,777 infected people in Kansas to date. This is the largest single-day increase in new cases for Kansas so far, as expanded testing turned up more infections across the state. Of those, 457 people have required hospitalization at some point, and at least 111 people have died. While the state doesn't track the number of Kansans who have recovered, Reno County Health Department is collating the recovery numbers from the various counties that are tracking it, showing so far 627 people have gotten better. But the state is now facing a much bigger number, making the coming months even more difficult.
Kansas faces a projected $1.27 billion budget deficit over the next 2 fiscal years.
On Tuesday, the governor went over the new estimates from economists across the state on just how much damage the pandemic has done to Kansas' pocketbook. And that means a hit to the services the state can offer the public.
It goes without saying that incredibly difficult budget decisions loom in the weeks and months ahead. As I mentioned yesterday, I've already instructed state agencies to freeze non-COVID related hires and identify cost-saving steps that will help protect critical investments as much as possible.
The governor says she and her team are still figuring out what those cuts will have to be and when they should come.
We are cautiously optimistic that we may be able to make some strategic decisions that help offset painful cuts to critical services in the current fiscal year.
With education making up the majority of the state's budget responsibilities and human services another large percentage, she says she'll try to protect those services, but can make no promises.
I can't really tell you that right now, but when I talk about critical services, I'm including education. So we will do everything in our power to avoid making cuts to those essential services.
And yet on Friday, as she made an update to that announcement, she said there is no way to protect those essential services completely. Joining me today to help figure out what this means for you, our State Representative Henry Helgerson, Democrat from Wichita, also a member of the House Appropriations Committee, and State Senator Carolyn McGinn, Sedgwick Republican and chair of the Senate Ways and Means Committee. Now, you both, as members of your committee, got briefings today on where we stand with the budget. So I want to start with the most basic question. What are the most important takeaways at this point? Carolyn, let's start with you.
Well, so the Senate Ways and Means, we were briefed yesterday, and the House had their briefing today via Zoom, of course. And one of the biggest concerns, of course, we have is the deficit that's occurring right now, and how long will that last? How long can we sustain the stay-at-home orders and still keep our economy going? So we learned a lot of things, but one of the things that we're trying to understand has to do with some of the money that's coming down at the federal level. How are we able to use those dollars and spend it properly because of the coronavirus? You know, their rules and some of their constrictions have to do with we can't backfill our revenues. Well, our revenues are being hurt right now because of the coronavirus. We're still trying to sort out some of that. It will help. It's going to go to higher ed, it's going to go to hospitals, it's going to go to K-12 and those kind of things, but it will not be something that actually will backfill our budget holes. So it was very good information today, or yesterday and today for the House, but mostly the part that's, I think, point has to do with people getting this assistance, and it has to do with those, because those individuals are out of work right now and they still have to pay their bills, they've got to feed their families and those kind of things. So trying to make sure the Department of Labor, the Secretary explained very much what's happened. It's been a history of a lot of years that we don't have the systems up in place, and they're trying to deal with so many. It's not just the 737 layoff as we've had in the past in a recession. This is lots and lots of our citizens that are in need of some kind of aid.
Henry?
Let me add in that we operate on the consensus, what the consensus estimate gives us, the figures. And what we heard today was it's a best guess. They're estimating that it's going to be a U-shaped recovery. But there's nothing saying it doesn't end up being a W, meaning we go up partially and go back down. And that's the real question mark. Are our revenues going to return next year, or are they going to be depressed even more? That's a big question mark that all of us have to keep in our back pocket.
Now, a comment that the governor made on Friday as she was talking about the budget issues is that while we've made some recovery as far as the state economy goes over the last few years, trying to make cuts, there isn't a whole lot of fat left to cut out. So where are we most likely, or what are the most likely targets for cuts? Has anybody even thought that far yet? Henry?
Yes. First, I agree with what the senator said about it's painful. It's painful out there for a lot of citizens, and we have to keep that in mind. But we also know there were a lot of programs added in the last 2 years. Last year we added 10% into the budget. The year before, this year, for next year, we're adding 6% in. Those kind of increases have some additional programs that there's a constituency for. But we don't have the luxury of dealing with those now. The senator and I were joking earlier, we could probably put together a budget between the two of us right now that would not have a lot of cuts. We could rob capers. We could use the pool money investment board or delay payments. We could take the transportation money, the sales tax, and bond those programs. All that does, though, is doesn't deal with the problem that we don't have the resources in this year and in the future years to deal with the problem. We have to start with some base budget cuts, and it may be across the board. It may be on all the additions that we've added. We've added, in 2 years, $1 billion to the state general fund budget. Maybe that's where we're going to have to start.
Carolyn?
Well, first, I just want to say that I think it's too early to start talking about cuts. It will have to happen in some form, whether it's through the allotment process or whether we even go back and we make any kind of adjustments, or we still have time. So the end of the year will be July 30th, and the ending balance is $205 million. That's all changed because of consensus revenue estimates. They gave their best guess, and I agree with that. This is only a guess. I mean, we used to be able to call it a prediction. And now it's clearly a guess because we just don't know the future of what's going to go on. The following year, we're looking at almost $700 million in the hole. But my point is, we don't know what kind of federal money that could come and help stimulate our economy. We don't know how long the virus is going to last. We don't know what it's going to look like when we open up our economy. So there's so many what ifs out there right now, but there are things that we can do. I just want to make sure it's clear that I did not agree with those items that he was talking about, but those are areas that we would have to take a look at.
Well, and you mentioned we don't know what to expect, and that uncertainty is certainly a big issue, especially for many small businesses across the state. All those businesses closed and people currently out of work, creating serious questions over whether some businesses, many of them small, will be able to reopen once the economy does, as I explained in this report I filed with Cake News.
I'm not asking for hundreds of thousands of dollars, even tens of thousands of dollars. You know, I would just like half of what my income was to just make that lease payment.
Jennifer Main has run a nail salon in Salina for years. She was moving to a new location when the stay-at-home order came down. Now, she wonders if she'll ever be able to open her new salon at all.
I mean, I have a lot of loyal clients and friends that I greatly miss. You know, seeing them every week, every 2 weeks, it breaks my heart. And to know some of them may not be able to come back.
And she's not alone. In a survey released Wednesday, the Kansas Chamber says 64% of its members believe it will take at least 6 months to get back to normal after all this. While a similar survey from Main Street America showed 2/3 of Kansas small businesses don't think they'll survive that long. The things they need most? Help paying the rent, paying their employees, and getting supplies.
I just want answers of what help we're going to get.
Virtually every business in the country has been affected, no doubt.
Wayne Bell with the Small Business Administration in Wichita says they've had widespread interest in the Payroll Protection Program and the Economic Injury Disaster Loans, but both are currently out of money, something he hopes will change soon.
What eventually is passed in this next round, there are going to be some earmarks or some funds, if you will, kind of set aside to specifically address rural communities and businesses that are small, minority-owned businesses, that sort of thing.
And just in the last few hours before recording this show, President Trump signed a new version, an extension on that CARES Act that includes $320 billion for the PPP program, with $60 billion of that set aside for businesses that do not already have a relationship with a bank, one of the big problems that some faced. And there's also $60 billion in that for the Emergency Disaster Loan Program with the Small Business Administration. So some help coming from the federal government. The question becomes, is there anything in addition that the state can do for small businesses?
Well, certainly in the areas of regulation and those types of things, but our money will be limited. I just want to say the strength of our economy are our small businesses. And so some will adapt, some will not make it, some new businesses will be created. It's going to be painful, and my heart goes out to them because that's certainly the backbone of our economy.
Yeah. So as we move forward, where do we go from here, Henry?
I wish I had the answer. I think I go back and we got to find a solution to the state budget to make sure that there is that security for people out there, that they know when schools are open, when they're going to be able to put the kids back in the schools, give them some security in that. And I wish we could do more for small business, but we're just not going to be able to.
You know, this last week there was a major protest in Topeka with many Kansans, hundreds, showing up demanding that the state reopen, preferably now. Medical officials, scientists such as Dr. Lee Norman, the KDHE secretary, have said that's really not feasible at the moment. What are we looking at from what you guys are hearing? I know the LCC has indefinitely delayed the return of the state legislature. Henry?
I think I'm going to follow whatever the secretary says. I'm going to go with the experts. That's what's necessary. I wish I could give them something better, but I don't want to have that W come back and throw the economy into a real tailspin.
You know, people are frustrated and they want to get out. They want to get back to work. They want things to be like it used to be, but it's not going to be like it used to be. So we will have to do things a little bit different. But the most important thing is we do have to depend on some science. We have to make sure we don't overload our hospitals. Our hospitals are there for not just the coronavirus. There are other needs, car accidents, other health challenges. And so we want to make sure we don't overload our health facilities and particularly our healthcare workers.
Now, if we look back at the Spanish flu, the last time we had a major pandemic in the United States, I'm a historian myself, I've done the look backs. There's lots of stories about, for example, the government putting in rules about everybody having to wear a mask when they go outside. If we see multiple waves of this, which a lot of people are starting to predict a second wave in the fall, is that something that we may be looking at? Henry?
Yeah, that's a possibility, but I think we're going to be reasonable and smart, and we're going to try to stay away from people and control the problems that are out there. Most people are doing exactly what they have been told to do, and that is distance themselves and be reasonable.
No.
Some of those things are going to end up being state by state, based on population, the economy, those kind of things. But what the good news, I felt like I was on a Zoom meeting with Harvey County local government folks, and they are already assembled a group of people to figure out how do we move back into the letting people do more things and those kind of things, and how do we protect them. But they want to do it county by county, and Sedgwick County had conversation this morning, and they're trying to figure this out. And it may end up that we do it county by county, because every county is unique and different in our state. And I think I trust local government, and so they're already preparing to figure out how we're going to go back.
So is this, you talked about the frustration and anger that people are feeling right now, and certainly I've seen a lot of that as well. Do events like the protests that we saw in Topeka this week provide a useful outlet for that, or are they a greater danger to the public?
This is America. That's freedom of speech. I wasn't there, so I did not see how close everybody got, but I hope that they practiced a little bit of distancing and they had their voice heard, and we're listening, and we're trying to figure out, again, how can we get back to the new normal? It's not going to be the old normal. No. For a while, it's going to be a new normal, and satisfy some of those things that they're asking for.
And I'm sorry, Carolyn, I'm going to give you the last word on that one, because we have another very important interview we want to get to, from county commissions to the governor and the White House. Word is we need to have declining numbers of new cases for at least 14 days before lifting restrictions. How close are we to that point? I asked the KDHE Secretary, Dr. Lee Norman, that and more in an interview I recorded with him earlier in the day.
Dr. Norman, thank you so much for joining us. This has been an incredibly busy time for you. I know that, and we appreciate the time that you're taking out to spend with us here on Kansas Week. The biggest question I think that so many people have is, where are we? Are we actually in the peak? Are we starting to come down from that peak at this point?
Yeah, real good question. You only know that you're coming down off of a peak when you can look at the last couple of weeks in the rearview mirror and say, yeah, this is where we are right now. And there's, without question, we are coming down in terms of our hospitalization rate per capita and our death rate per capita. The one thing that confounds this and makes it a little bit hard to explain, but I'll take a whack at it, and that is, as we have ramped up and up on the testing, we are going to find more cases. And so on the one hand, the number of cases we have are positive, and the number of negatives, of course, will go up dramatically as well. So it might appear as competing messages, if you will, but in reality, if you did no testing, you'd still have hospitalizations and death rates to monitor. The fact is, we're cranking up on testing, and it's really good to see that a fairly low number of positives, and should be continuing to drop off.
So a lot of folks are really pushing for reopening the state on May 3rd, May 4th. Is that a realistic goal at this point?
Well, I can assure you that if there's more liberalizing of the economy and people movement, it won't be like a switch off and a switch on to just business as usual. It will definitely be done through a graded mechanism. The governor, and I'm not speaking for the governor, she'll roll out the plan next week, and I'm not sure exactly what day that will be. We're contributing to that from a public health perspective, of course, and I'm imagining that it will be in a graded manner, and as certain metrics and certain trigger points to hit along the way. We're looking at all different models. The White House has a really nice framework. Johns Hopkins has metrics and trigger points. The American Enterprise Institute has one. So there's a variety of those And we're following what other states have found to be successful. So I think that we'll see a relaxation of some of the rules, if you will, but it'll be done in a very prescribed and data-driven manner.
So as we move forward, lots of things going on. One thing that you've talked a lot about are these various clusters that we've been seeing. In particular, there's a big hullabaloo over the religious gatherings, and there's at least one cluster that at the time you had said came after the order against religious gatherings larger than 10 people had gone into place. We saw the big protest this week at the State House. Are you worried about new clusters developing because of that?
Yes, always. And please understand, I don't have anything against religious gatherings. I just have something against all gatherings until we get beyond this. I'm not picking on religious gatherings. There will be more clusters. I have no question about it, which is, again, one of the philosophies as to why we want to broaden testing, because we can't, practically speaking, test every man, woman, and child through 3 million people in the state of Kansas, but we can do population sampling and then find hotspots. Hotspots is another way of saying, here's a person who gave it to 2 people, who gave it to then 8 people. That's when you do the classical contact tracing, testing of the people around that, and then you find another one, you test around that person as well. I think we'll continue to see clusters like that. We have now in the state of Kansas 52 different clusters we're monitoring. Some are small with just a handful of people, and some are quite large with 377 and in the 19 long-term care facilities, for example. And they've accounted for a fair number of deaths.
And nursing homes and long-term care facilities, group homes, seem to have been the largest group of clusters that we have seen. I know at the national level, they've talked about and have made some changes in how those organizations have to report cases. Are we making changes here? Do you feel like nursing homes are doing a good job at reporting? Because there have been complaints.
The reporting, I think, has been pretty good. Quite honestly, I think that this has been hard for skilled nursing facilities, and quite honestly, I think some stepped up with the public health measures sooner than other ones did. And some are just more difficult. You know, no two skilled nursing facilities are like. Acute rehab centers have a lot of equipment where you're leaning on things and lots of, weights and things like that, lots of touching that goes on in those settings. So it's a very heterogeneous group in terms of long-term care and acute post-hospital rehab. But they're a very vulnerable population and have to be absolutely meticulous. And quite honestly, I think some of them pay more attention to the details than others. And this virus, if there's a chink in the armor, it's going to find a way in.
Talking about the clusters, probably the biggest growing ones, fastest growing ones right now are the meat packing plants out in western Kansas. What's the latest as far as efforts at containment there?
Yeah, we've had approximately 250 cases emanate from 6 meat packing plants, and fortunately no deaths. That's a fairly young population. So they have not overly been manifesting illness. And one of the interesting things, and I was talking with a doctor colleague out there yesterday, that a lot of them that have been tested positive might only have headache, backaches, muscle pains, but not necessarily having fever and primarily respiratory manifestations. So that kind of violates the rules a little bit about this organism. So we've had to adjust as time has gone on. But it's not surprising. It's a pattern that we've unfortunately seen in Iowa and in Sioux Falls, South Dakota. Wisconsin's had big outbreaks. And to answer your question, Pilar, we have 3 additional CDC staff there out in Southwest Kansas now that are boots on the ground, helping to provide 1 more sets of eyes and ears to assist with the local health departments. We have some 4 additional CDC staffers here helping us iron out and think through testing strategies and hopefully get access to the materials that we need. So we put additional resources out there, but it's daunting. I mean, we're talking about thousands of workers in close approximation. And we saw this coming, and the packing plant companies themselves have really stepped up with what we call engineering controls, meaning spacing people out, putting plexiglass between them, protective equipment, altering their shifts, break time to make sure they're not close in approximation with each other. We have CDC and NIOSH, which is a kind of an OSHA-like organization that helps to think through if there's anything else that we need to strengthen. So I think it's really we got additional testing going on. The one thing I think is still going to be very hard is that these people go home at night. And, you know, when somebody comes down with an illness, you don't know if they caught it at work, you don't know if they caught it at home. And just because they're a young group of employees, for the most part, they go home to families who are vulnerable. There's oftentimes multi-generational families living under one roof. And the employers have better control, if you will, at the work setting. But once people go home, they're on their own with the help of, you know, the local county health departments, for example.
So one last question before we let you go, Dr. Norman. President Trump at his daily conference yesterday suggested things like injecting Lysol. Have you guys had any calls or questions about that? What is your advice when it comes to something like that?
Well, that is not recommended in any way, shape, or form to ingest these industrial compounds, really, and cleansers into the body. I'm going to call my friend and colleague, Dr. Steve Thornton, who is a medical director of the Kansas Poison Control Center. He's the only certified toxicologist in the state, to see. I'm sure they've gotten lots of phone calls about it today. I'm hoping that people will read the labels and use their common sense. I have a hunch that the president maybe wasn't really recommending that so much as inquiring if that was something worth exploring, but I'll leave that explanation up to the president.
All right.
Not a good idea, I will say that.
Okay, well, thank you so much. I really appreciate your time.
And a special thank you as well to Senator Carolyn McGinn and State Representative Henry Helgerson for joining us today. We end today's show on a somber note, a final salute to David Seaton. He served as the publisher of the Winfield Courier for 28 years and as a former member of the KPTS Board of Trustees. He was also a frequent panelist on earlier versions of Kansas Week. His commitment to fairness, justice, and community service will be greatly missed. Have a good week.
Southwest National Bank has proudly served Wichita and its surrounding communities for over 100 years. We are happy to support KPTS, Public Television for Kansas.
Continuing coverage of the COVID-19 pandemic in Kansas is funded in part by a grant from the Facebook Journalism Project Community Network Grant Program, run in partnership with the Linfest Institute for Journalism and the Local Media Association.